Over the years, the policy dialogue have remained one of the critical decision-making platforms for national multi-sectoral HIV and AIDS response in Nigeria. This provides opportunities for discussions on issues for adoption to achieve national set target. Hello and welcome to this episode of The Last Mile with NACA. I am Adesuwa Osui. This episode is about a policy dialogue with relevant stakeholders organized by the National Agency for the Control of AIDS, NACA, on the new Global AIDS Strategy and Political Declaration. Keep watching.
Whenever there is a new global strategy on AIDS by the United Nations, stakeholders in Nigeria, led by the National Agency for the Control of AIDS, NACA, review and compare with the national strategy to either adapt or adopt aspects of the global strategy to suit our peculiar context. In line with this, NACA recently organized a one-day national policy dialogue on the new Global AIDS Strategy and Political Declaration. Delivering the welcome address, the Director General of NACA, Dr. Gambo Aliyu, stated that the new Global AIDS Strategy has cost implications on the National HIV and AIDS Strategic Framework but will be addressed during development of the National Strategic Plan.
The current National HIV and AIDS Strategic Framework, 2021 to 2025, was developed before the Global AIDS Strategic Plan and also the Political Declaration. The framework, which is designed to guide the national response to HIV and AIDS, was, I think, developed shortly after the NACA survey. We've also revised size estimates for key affected population in 16 states, plus the Federal Capital Territory, Abuja, and conducted a revealing study in Nigerian prisons. The framework is grounded in the National HIV and AIDS Policy, which is revised in 2021. The National Strategic Framework is also costed based on the targets to be obtained by 2023 and 2025. The new and adjusted targets in the current Global AIDS Strategy and Political Declaration have implications for the existing costs of the National Strategic Plan and will be addressed as we develop the National Strategic Plan.
Dr. Aliyu also stated that the country is already implementing aspects of the new Global AIDS Strategy and Political Declaration.
Nigeria is already implementing aspects of the new Global AIDS Strategy and Political Declaration, such as differentiated service delivery models, patients' empowerment, community-led monitoring, and aspect of women under productive age, gender assessment, stigma index, and programmatic measures to address inequalities, priority initiatives incorporating key population, i.e. transgender, and people-centered services articulated in care and support guidelines as part of facility and community interventions. It is also important to note at this point that the updated guideline and implementation for treatment, community care support, gender and human rights are already addressing social protection issues, mental health, non-HIV related communicable disease management using the multi-sectoral approach. Notwithstanding, some populations and program areas are still being left behind. Therefore, this dialogue meeting is for the country to look at the component of gas and PD to implement and or subsequent domestication and dialogue on them and guide the development of the National Strategic Plan 2021 to 2025.
There were goodwill messages from stakeholders, including the National Coordinator of NASCAP and representatives of the UN systems and PEPFAR.
the political declaration almost reads like a technical document, because it went the extra mile to try and make many things clear, and that has given us a great opportunity. So I want to thank the DG for taking forward that opportunity and translating it into a conversation at country level, because that is the only way we can now take what has been boldly stated and translate it into actions that we need to take. Investing in health, that's going to be critical for taking us to the end of the road as we desire to reach. And for us in the health sector, that's critical. But in addition to investing in health and exploring all the options that we need to explore, we also need to address the issues around efficiencies, so that whatever resources are available, we can make the most of it. And of course, that is tied to science.
This particular policy dialogue is very critical, because we have basically two periods in HIV, or maybe three. One period when people were just dying and nobody knew what to do. The second period where we knew what to do to save lives, and we began to save lives. And thank God, lives have been saved everywhere in the world, in Africa. Now we're moving into the third phase. Ending AIDS means that everybody who has access to treatment should be living long, living normal lives. It's the end of AIDS, and that's what this policy dialogue is about. How do we get to the end of AIDS?
This policy dialogue comes at the very right moment, especially since we'll be hosting over the next couple of weeks the significant third partner in our national alignment conversation, the Global Fund country team. It's good that we are clear about what our intentions are as a country, and that we are able to engage all of our collaborators to rally around these priorities, these new sets of priorities. One thing we have demonstrated the capacity to do is that when we set our minds to do something, we have demonstrated the capacity to actually do what we say we are going to do. And I think the whole world applauds us for that. So we look forward to more success in this collaboration. And to our community members, we use this opportunity to reinforce our collective commitments to the priorities that have been set forth, and definitely to giving you your rightful place in national response. We know that this response does not attain its full success without the role of communities.
I wish to thank NACA for making it possible and finding NEPWAN worthy to be part of this policy dialogue. It is our desire as NEPWAN, members of the community, to be part of every activity that concerns and involves HIV in the country. Gone are those days we continue to be volunteers. We have gotten the experience. We have the capacity. We have the wherewithal. We can be meaningfully involved and engaged in any program. It's my appeal to this August gathering that the community should not just be carried along only once in a while. For every implementing partner in this country, so far it has to do with HIV intervention, NEPWAN and the members of the community should be meaningfully involved.
All those discussions we're having, we need to quickly transform into sustainable financing. Everything boils down to what? Financing. Most of the sectors are not really working the way they're supposed to work. And we need to actually walk the talk. We have come for the discussion, but we need to walk the talk and let there be action. Sustainable financing for the basic interventions that we already know. ATS, the commodities, PMTCT, but particularly with emphasis now on the private health sector, the public, yes. Anywhere there's antenatal service, there's a should PMTC service there. That's what we should be looking at. Also ART, and also the quality, provision of quality care and support for PLHIV.
A major challenge facing HIV control in Nigeria is the growing number of people living with the virus but are yet to learn about their HIV status due to fear of stigma and discrimination. HIV self-test kits is a simple, effective, and quicker way of learning about your HIV status in the privacy of your home. The test can be performed using saliva by rubbing the outer part of your upper gum, followed by the outer part of your lower gum with a flat pad, and then dipping the flat pad into a buffer tube to wait for 20 minutes for the result to read. For more information, contact our call center at 6222 or NACA's website. Our services are available to you Monday to Friday every week.
An overview of the new Global AIDS Strategy and Political Declaration was presented by the process consultant, David Akingpalumi.
Okay, the first one, we'll be looking at the Global AIDS Strategy, which is fondly referred to as GAS. The vision has three components. The first one is zero discrimination. The second one, zero new HIV infection. And the third one is zero AIDS-related death. There are three strategic priorities on the GAS. And the first one is maximizing equitable and equal access to HIV services and solutions. The second, break down barriers to achieving HIV outcomes. And we'll move to the third priority area, that is fully resource and sustain efficient HIV responses and integrate them into systems for health, social protection, humanitarian settings, and pandemic responses. We move on to political declaration. In the document, you have themes and you also have focal areas. Okay. The first theme has to do with getting on track to end AIDS. This contains information and decisions to come together globally. Governments of various countries to come together, which they did between 8th and 9th of June 2021. And that forms the first declaration in the document. The second theme has to do with call to action to end AIDS. Okay, then you have the larger chunk of it under the third theme, which is political commitments by head of state and government and other key stakeholders. That is what they have agreed and committed to do.
First panel discussants focused on the Global AIDS Strategy and Political Declaration, addressing inequalities and addressing the 2030 Agenda.
So the first thing I have here is evidence. Nigeria is data rich. Nigeria has data. So we really need to probably interrogate the data more. You know, look at that nice study, look at some of the other studies that have been done, look at some of the non-health data as well. You know, do we have a profile? Do we know the persons who have been lost to follow? Who are they? What are the commonalities in those groups? You know, do we know the persons who are not coming to the healthcare facilities? What do we know about them outside of their health information, and how are we using that information? The second point I have is around partners, and this is crucial. So we get the evidence, we ask the right questions, we get the evidence. Who do we need to make sure that that multi-sectoral space is saturated and we have what we need to end the AIDS epidemic? So we need health, we need education, we need labor, we definitely need communities. And the third is legal and policy environment. And of course, I can't overemphasize the importance of sustainability planning in all of this.
We are closing in on epidemic control. And that's where the challenge is. When we talk about sustainability, our view is only towards financial sustainability, local leadership, local ownership, local financing. We shouldn't just keep our eyeballs on the resources. We should also keep, after epidemic control, what happens? How do we sustain that result to keep the lead on that result? And that is where the PD comes in, because it identifies those little things. Those things we need to focus on. And that's where when we talk about communities, I see community as community of trans, as community of people living with the virus, as community of APIN, adolescents living with the virus. Not until we prioritize those community views and we make those people, we are not looking at geographical community this time around, but we're looking at community of people who have the same issues, the same barriers, the same problem. They are the people that can solve their problem. They are the people, if we put them at the center of response, which we are doing, but not to scale. And those are the things we must focus on and scale up. And we will get to sustain even our results down the line.
Sustainability of HIV and AIDS response amidst related emerging diseases of public concern was the topic in the second panel discussion.
Before the COVID-19, when we look at the health indicators, most of the country were on track. But you can agree with me that COVID-19 has exposed inequity within country and among countries. But somehow Nigeria managed to control this pandemic. We're not out of it. So when you look at what will be required for, and taking the example of Nigeria again, and taking the example of the HIV program, at the beginning of the epidemic, at the beginning of the lockdown, we know that the 95, 95, 95, and 10, 10, 10, all of them has been affected. The main lesson learned is not only, it showed the importance of universal health coverage. So making sure that everybody have access to essential health service. So we need to invest in universal health coverage. Revitalizing primary health care, because they are the primary health care is the closest to the community and the population. And talking about the community, empowering the community again for them to take care of their own health.
2-3 years ago, we started a path on what we call the national alignment, the national HIV alignment. Very specific again to HIV, but again, this is recognizing that there were several other resources in the HIV space, that even within the same space, we were working in silos. So the national alignment was essentially an effort, and it's an ongoing effort to at least try to address the fragmentation that exists even within the HIV program. And of course, COVID became an opportunity to see something new in being able to leverage these systems to do some other thing. So, in essence, the effort that we made on the alignment, which is basically trying to figure out how to make sure that the resources do better in terms of working together in the same space, is already the right effort in the right direction. So it is time, really. What I think the conversation we're having now just says that it is time. The resources are not enough anymore. So for the sake of leveraging each other's resources, scarce resources, you use mine to achieve your purpose, let me use yours to achieve some of my purpose. For the sake of that alone, we have to integrate. We have to work towards integration.
Some participants shared their thoughts.
Today's program, which is the policy dialogue that has been convened by NACA, is such an important program. It has given us an opportunity to bring together partners from different dimensions of the national HIV response to look together at what we have done, where we are, and how do we move forward, particularly in the context of what the global strategy is all about and the political declaration. So this is a great opportunity to simply retool, rethink, and relaunch our approach as a nation.
Nigerians will develop good policies, but the major challenge is implementation. A lot of time, people agitate for individuals, not communities, and not the focus of the policy. And most of the time, the structures on ground, they're not part of the development of the policy. So when it comes to implementation, there's a problem. If you're looking at the policy to address some issues, let the communities or the stakeholders, relevant stakeholders, to be part of the development of the policy from the beginning. So that when there is implementation, everybody is informed on how to go about it. And even from the policy, let us know how you are going to fund the implementation. You have federal, you have state, you have local governments. You understand what I'm saying? Most of the policies in HIV are developed at the federal level. So we need to domesticate it at the state level. Yes. They have the resources to domesticate it. These are some of the things that need to be factored into the development of the policy and also in the implementation of the policy.
The importance of this workshop is that for us, as an organization, for the first time, NACA has actually involved the community in the planning in such a very high-level policy dialogue like this as being part of the program. So we feel it as an honor, because for a long time we'll be clamoring for the involvement of the community. And we have actually requested that the voice should not just be added, but it should be included, and to be one of the forefront in any submission to HIV intervention in Nigeria. And what is this all about? It's about including the community in the design, development, and implementation of HIV interventions in Nigeria. So we look forward to more collaboration with NACA and other partners in Nigeria working on HIV.
The importance of this particular meeting, it's for us to look at the global strategy and also the political declaration and see where Nigeria stands. And so far it's becoming very glaring that we actually, act in terms of our interventions, in terms of the milestones we've achieved over time. But I guess there are also some gaps that have been identified, and some of the things that we need to strengthen going forward. Typical is the first one is the issue around putting the community at the center, which is quite key. So in other words, we're not just talking about the community system as an add-on, but as an integral part of our health systems. And that will really help us achieve, milestones. The other one is the issue around not just looking at the patient as with just a disease, but also looking at the totality of the patient in terms of this same patient beyond HIV, beyond health, also needs other services, social services, what public health experts will call other social determinants of health. I guess that the third one is the issue around, data. How do we ensure that our data is really evidence-informed? It's not just collecting data for collecting sake, but our program should be driven by science.
Resolutions from the one-day National Policy Dialogue on the new Global AIDS Strategy and Political Declaration will be instrumental in achieving national set targets.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Ade Suwasi. Goodbye.